Hello, everyone. Good evening. Welcome to tonight's webinar. We get to talk about the largest organ of the body, the skin, and how we take care of our skin. Right, Dr. Chris?
Yes, we are. And actually, Dr. Tina, we've got a presentation on Friday. It's going to talk about an organ that's actually larger than the skin. So we've got some news for everybody. So we'll talk about that on Friday. And welcome, everyone. So glad you could join us on this Tuesday evening. And let's get started. First of all, there's nothing that represents the quantum rejuvenation better than our skin formulations. And because our Surion and TeloYouth and of course our TeloMega all affect the skin. And we're going to be talking about the topical, the Surion, primarily this evening. And it's significant to understand that we're energy beings first. We always talk about that. And it's so important to understand that our energy is what enhances our stem cell production for recreation, for release, activation, all part of the rejuvenation process. And then there's a hierarchy that exists. It starts, right at the core of the cell, and then cells build up the tissues, and the tissues build organs, and the organs make the systems to develop the body. So we have this wonderful, orchestration that happens on developing the whole body, Dr. Tina.
We do. And, in TeloYouth and TeloMega focus on this cellular level from the inside of the body. But tonight we're going to talk about how do we focus on the outer layer of the body, just specifically regarding our Surion skin serum. But all three of our formulas are, and we can put Telepet on here as well, are full of what we call these signal molecules, and they are the body's language or the software that coordinates and orchestrates all of the systems or applications of the body. In other words, if you can think about all of the cells of our body, and you look at these smartphones over here, think of them as like an individual cell in your body. They have to communicate with each other back and forth. They have to talk, just like we have wireless that communicates. We have different functions like these applications. There's the functionality that has to happen, and there's so much of it with every individual cell. And all of those have to be working optimal. And when we're young, our cells are like a smartphone. They are functioning very efficiently and communicating. And then we move through time and the clock moves forward. Our toxic burden becomes heavier in the body. We lose our ability to detoxify. We lose energy. We might have traumas, but we move into a more of an accelerated aging, even as our stem cell pool declines. And those cells, they, they lose their functionality. They lose the communication. And so it's like having them go back to an old rotary dial phone. And then you start taking your TeloYouth and your TeloMega, the quantum rejuvenation program, and it upgrades because as those cells turn over, it cleans out the cells that are not functioning very well. And as these new cells are being recreated, they're beginning to get healthier and healthier with the receptor sites, with all the functionality, that communication. And then we have these signal molecules that we infuse back into the body to help the overall processes with the entire body. Dr. Chris, do you want to add anything?
Let's just jump right in and talk about the skin and the connective tissue. It's just so key to see the depth that exists here because the collagen is found in the skin and the connective tissues, the tendons, the ligaments, and the cartilage, also in the blood vessels, muscles, gut tissue, dentin. So the complexity of the skin is just a remarkable organ, and most skin formulas are just topical moisturizers. They don't deal with the organ structure and its repair and its rejuvenation. And this is what it's so special to have a formula that is a healer, a rejuvenator. And so it's not just about moisturization as much as it is fortification and rejuvenation, Dr. Tina.
It is. And, when we're young, I mean, you think about our skin as the barrier to the outside world and all of the toxins that are in the outside world. We have to have a very healthy skin barrier. And you can see with all these different layers, it's very complex. And the body is just so miraculous how we can repair the skin, strengthen that barrier, and really have that beautiful, glowing, healthy looking skin as well. And collagen is the topic when it comes to looking at your skin. And once you reach 18, your collagen content is at its peak. Uh, in other words, you start aging right after that. So by the age of 19, you're starting to age and break down your collagen. So by the time you're 80, the production of your collagen might be 75% of that of someone in their early teens or early 20s, or in their teens or early 20s. So you just think about, naturally this is going to decline, but it can be supported. And we see, even if people aren't using Surion, we see that their collagen, when they're engaged in the quantum rejuvenation program with TeloYouth and TeloMega, their skin changes from, quantum level 2 and quantum level 3 dramatically within a short period of time because you're building from the inside out all of those different layers that we looked at on the previous slide.
All right. So let's look at the various deficiencies that can manifest uh, impacting the collagen. And specifically, when we're looking at the skin, we're looking at the sagging skin. The sagging skin is just not the structure of the skin, but it's also the bones and the muscles. So you're looking at repairing the entire body. Also, we see a correlation strongly with hair loss or breakage. And we're talking about not just the hair on the head, but throughout the body. And of course, the hands and feet show the brittle nails, again, a collagen factor, and then the wrinkles and fine lines, not just in the face and neck, but throughout. So a person would lose weight and they just see this, the saggy, and all of that doesn't have to happen when you have this rejuvenation capability to revitalize the skin. And so here's all these different areas, Dr. Tina, that are impacted with collagen.
Absolutely. And collagen, so when I see this slide here and I look at all of these different areas, it's not just about the beauty of the skin. Collagen is the glue that holds all of our cells together. So making sure that our collagen is supported is important, from the inside out and the outside in. Let's take a look at how skin rejuvenation declines. You see babies, their skin is just so nice and plump and, if we always say, look, oh my goodness, your skin is like baby skin because it's beautiful and it's radiant. And that's because their skin cells are turning over every 2 weeks. They're growing. They have to have new skin that's developing very rapidly. By the time we turn into a teenager or early 20s, our skin starts to turn over every 4 weeks. You look at the 30s and 40s, those ages, it's every 8 weeks, so about every 2 months. And then after the age of 50, it's about every 3 months or every 12 weeks is when our skin cells are going to turn over. And we're going to talk about how you can accelerate what we want to do is we want to go backwards. We want our skin cells to turn over quicker and help them become healthier. And we do that with our quantum rejuvenation program along with our Surion. And there's some tips that I'll share with you as well. Now, key factors. Your aging skin is also determined by your genetics, your environmental factors, like how much sun have you been exposed to, and your lifestyle. It's important. If you're not drinking water, if you're not hydrating, your skin is going to look worse than somebody who is hydrated. Also, if maybe you have worked out in the sun for years, you're going to find that your skin is going to become very, very thin as you age, and it's going to become, the collagen is going to be breaking down faster. So, um, it's another thing to maybe consider.
All right. So Surion's communication molecules we refer to them as oligopeptides, but again, just a fancy word for signal molecules. And they're nutrients to replenish. They're just incredible chemical messengers that have the ability to repair. So these peptides, they bind to receptors on the cell membrane surface, and their primary function is to activating the cellular activity. So you see chemical messengers between the cells, increase of the growth rate of healthy cells, and the cell proliferation requires, the internal dynamics of the blood vessel growth and development, the collagen, the elastin, the fibromectin that we've been talking about. So again, you see an orchestration that goes on with the skin, and we have this with all our formulas. And we've had a presentation with our telomega, how important it is for hydration and elasticity, and all of that ties together. But the Surion is the most powerful wound healer, just you can use on the body topically. So really something that I know we've been using a long time, Dr. Tina, and we can appreciate, right?
Absolutely. So just to give you an idea here, this picture, this is a receptor, this is a cell line, right? And then these are the signal molecules, and this is on the inside of the body. And we have very specific signal molecules as well that you apply to the top of your skin that actually pulls these cells, these repairing cells to your skin. And this is why we see such great results when you add in Surion into your quantum rejuvenation program. So let's take a look. Here is my friend Maggie. When she was in her 60s, this is her before picture. Her son used to tease her. Her teenage son called her a turkey neck. Not very nice, but you can see the wrinkles. Um, and after 21 days, look at the results of how she was, taking her, she had the TeloYouth and the Surion. So she was working from the inside out and the outside in. 21 days, huge change. No like neck lift or surgery. That's just a natural change in her skin.
Yes, and here we show this the one of the primary burn studies that came out when the formulator back in 2006 actually started studying in the hospital and showed this example here of just a young baby that had not only remarkable healing but just so fast with no scarring. So look at it in the beginning, before, 7 days, 14 days, and 21 days. It's just like brand new skin and regenerated. So the key is no scarring. So that shows that the technology has the ability to activate all the dynamics. You saw the complexity of the skin. Every one of those dynamics is incorporated in order to do regeneration the way we look at it. So great,
Yes,
great,
and
great story.
our friend the doctor who discovered these oligopeptides, he was telling the story. This event incident happened in Mexico City, and this little guy was sitting on his mother's hip and accidentally dunked his arm into the vat of deep fried oil. She was deep frying tortillas, and he put his arm in there, and so you can just imagine, you know, the devastation that she was feeling while she rushed her child to the hospital, and he went in with these oligopeptides and look at that. And by the way, this would be like putting Surion on the skin 2 days or 2 times a day, morning and night. So powerful to help heal the outer layers.
In the hospital environment, Dr. Tina, they did not just burns, but they did skin grafts and showed how to regenerate the skin for people that had to go through skin grafts. So very powerful.
Yes, and then here's Beth Ann, another friend of mine. She saw what happened with Maggie and decided that she would give it a try, the Surion, the skin serum a try. And you can see in 19 days, big difference in Beth Ann's skin. And again, she was also taking TeloYouth, the fertilized tissue extract as well.
And here we have a client, Dr. Tina, that very interesting here because it's just not a topical skin issue as much as it's an autoimmune condition. So we're looking about the body internally as well and how it works in its systems. So this chronic autoimmune condition, that causes the pigment, changes, the vitiligo. This is something that regenerated and just a remarkable story. So, 60 days is nothing for the immune system to do the repair and rejuvenation, and something that's
A-
not even typical in conventional medicine.
Absolutely. You look at how the skin is starting to even out the skin tones. Just fantastic. I'm surprised at how many people I see with vitiligo these days. I just want to walk up to them and ask them to go ahead and start. And then here you have a man in Minnesota who, this was in the winter, he was going to put water on his sauna and he was in this hot sauna. And his arm was, he put his arm over the hot coals as the steam came up and it burned his arm. What's interesting is he did not even start the serum until 10 days after his incident. And you can see it wasn't healing very quickly. And then day 4, applying it twice a day. Look at how well it's starting to heal. And then day 7, twice a day.
Great stuff. So let's just wrap it up here and just talk about how this is another, wound healer in your toolkit for rejuvenation. And see the orchestration that happens with the skin's own renewal mechanism, the hydration, the elimination of toxins, improves elasticity and resilience. So many different dynamics. Dr. Tina, you want to share some of them?
Sure, and as the skin gets healthier, it starts eliminating the toxins that are, deep in the layers. So anybody, especially women, if you're using toxic skin products, what's going to happen is sometimes you'll start to break out as soon as you use the Surion, because pulling those toxins up out of the deeper layers as the cells are turning over, you start to see the skin tone even out. It gets more firm, fine lines and wrinkles disappear. You just see the whole balancing. And what we're doing here is we're helping the skin by applying this wherever you apply it. You help the skin turn over those cells. Now, a couple of tips and tricks. I really like when people are, sorry, is somebody unmuted? I'm just going to double check. Um, in using the serum, there's a couple of ways that you can maximize it. So you always want to wash your skin at night and pat dry your skin, but I will have you people usually use some kind of a exfoliation or an enzyme peel, a light enzyme peel to kind of get off that outer layer. For some of you guys that aren't going to do that, make sure you use a washcloth and just kind of scrub your face to get, that outer layer, the dead cells off, because then you're going to expose the skin and you're going to then apply the Surion after you've kind of roughed up the skin. And what it does is it just sends the stem cells to that area, turning over the skin cells faster, creating healthier skin cells quicker. I also have some women that will do microblading. Guys, if you shave, you're already doing microblading on your skin. And that's the best time to use your Surion is, after you shave, dry your face and put put on the Surion. For women, there are actual blades that take off that light layer of hair on the skin and that light layer of dead skin cells. I do that at least once a week or every 2 weeks just to make sure that I'm getting off that layer of the dead skin cells and apply my Surion. In the morning, I do not wash my face. The reason being, at night, after you put the Surion on your skin, what's going to happen is the pH is going to become very balanced. The oils in the skin are going to become very balanced. And then in the morning, you just, if you need to put more Surion on, you put it on. I just will lightly rinse my face, pat dry it, put on Surion, and then let it dry. And then I will put a sunscreen on my face. So one of the things that I did this last weekend is I had a little bit of excess sun exposure, sunburn. My skin got a little pink because I had a little too much sun. And what I did is I applied Surion twice a day and the sunburn went away. No peeling happened, but it helped to heal the skin. Just think of it as that little boy's burn. His arm was burned. We were healing burn. Well, the sun can do the same thing. It can burn us. So if that does happen to you, especially, this time of the year, you got to be careful. Use this to heal the sunburn, and it will be amazing. All right.
Great pointers there, Dr. Tina. So, shall we wrap it up here?
Yes. So we are, our flagship program is our quantum rejuvenation program, and we have 3 levels. Level 1 is about 1200% increase of your own stem cells produced and released in the body. What does that mean? That means that you'll have 1200% more like inside construction workers. That's what a stem cell is. It's like a construction worker. It's going to go rebuild any imbalances, help balance the immune system and all of these other areas of the body. And depending on what's going on with your body, will determine where the activity is going to happen. Every person has a different experience. Quantum rejuvenation level 2, double that. It's 2400% increase in your stem cell release into the system. And then when we look at quantum program level 3, this is for serious cases. This is for somebody who has been diagnosed with a very serious disease. Their disease is ahead of them. You end up getting 3,600% more increase in stem cells produced and released into the system so that some of that healing can happen at a quicker pace. Everyone is a little different. So, depending on what you're going through, will determine if you start at level 1, you might increase to level 2, you might increase to level 3. Some people don't even go past level 2, and some people are okay at level 1. A lot of it is determined by your age and again, those imbalances that you're dealing with.